Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Historical context of calcium and vitamin D. The recognition of calcium and vitamin D's importance to bone health has evolved significantly over time. Ancient civilizations, including the Greeks and Romans, understood that certain foods and sun exposure were vital for health. However, it wasn't until the 20th century that the specific roles of calcium and vitamin D in bone health were scientifically elucidated. The discovery of vitamin D's role in preventing rickets in the early 1900s and the identification of calcium as a critical component of bone structure led to a deeper understanding of their synergistic relationship in maintaining bone density and strength. Calcium's role in bone health. Calcium is a fundamental mineral in the human body, with 99% of it stored in the bones and teeth, providing structural support and strength. The remaining 1% circulates in the blood and is critical for various physiological functions, including muscle contraction, blood clotting, and nerve transmission. Bones act as a reservoir for calcium. When dietary intake is insufficient, the body extracts calcium from bones to maintain essential physiological functions, leading to bone weakening over time. Adequate calcium intake is essential to prevent bone loss and maintain bone density. Vitamin D's role in bone health. Vitamin D is crucial for calcium absorption and bone health. It facilitates the absorption of calcium from the intestine into the bloodstream and helps regulate calcium levels in the blood. Without sufficient vitamin D, the body cannot effectively absorb calcium regardless of dietary intake, leading to lower bone mineral density and an increased risk of fractures. Vitamin D also plays a role in bone remodeling, a process where old bone tissue is replaced by new bone tissue, maintaining bone strength and integrity. Sources of calcium and vitamin D. Calcium can be obtained from various dietary sources, including dairy products, milk, cheese, yogurt, leafy green vegetables, kale, broccoli, nuts and seeds, almonds, chia seeds, and fortified foods, orange juice, plant-based milk. Vitamin D can be synthesized by the body through skin exposure to sunlight, making outdoor activities important for maintaining adequate levels. Dietary sources of vitamin D include fatty fish, salmon, mackerel, fortified foods, milk, cereals, and supplements, which are especially important in regions with limited sunlight exposure. Symptoms of calcium and vitamin D deficiency. Deficiencies in calcium and vitamin D can lead to a range of health issues, particularly affecting bone health. Symptoms of calcium deficiency include muscle cramps, spasms, numbness, and tingling in the hands and feet, and in severe cases, osteoporosis and rickets in children. Vitamin D deficiency can cause bone pain, muscle weakness, and an increased risk of bone fractures. In children, severe vitamin D deficiency leads to rickets, characterized by soft, weak bones, while in adults it can lead to osteomalacia, resulting in bone pain and muscle weakness. Treatment and supplementation. Treating deficiencies in calcium and vitamin D involves dietary adjustments and supplementation. Increasing the intake of calcium-rich foods and vitamin D through diet or supplements can help address deficiencies. For individuals with severe deficiencies or certain medical conditions, healthcare providers may recommend higher-dose supplements or prescription vitamin D. It's crucial to monitor and adjust dosages under medical supervision to avoid potential adverse effects such as hypercalcemia from excessive calcium intake or vitamin D toxicity from excessive supplementation. Prevention of deficiencies. Preventing deficiencies in calcium and vitamin D is essential for maintaining bone health throughout life. This includes a balanced diet rich in these nutrients, regular physical activity, and sensible sun exposure to facilitate vitamin D synthesis. Public health initiatives often emphasize the importance of these nutrients through dietary guidelines, food fortification programs, and awareness campaigns. Regular health checkups and screenings can help detect early signs of deficiencies, allowing for timely intervention and prevention of bone-related health issues. These paragraphs provide a comprehensive overview of the critical roles calcium and vitamin D play in bone health, covering their historical context, physiological functions, sources, symptoms of deficiency, treatment, and preventive measures.